Yeah, no, I think it's really been impressive, the meeting. I think that one of the things that's been impressive for me is, having worked in this field for a while, seeing the evolution on both sides. That in the early stages of dealing with this, you had a rather small number of people on each side who are interested in making this connection. Now we have a really strong body of people who are working across a massive range of diseases, bringing together different disciplines, different techniques, and I think a much better understanding amongst the climate community about what the real problems of the health community are and their constraints. I would say it used to be that climate people, because they have massive amounts of data and are used to dealing with big data sets and really sophisticated computing, that they would think that because they had all of this information at their disposal, that would automatically solve the health problem. And in reality, very often, health people don't even have quite basic data on the health side. Often they need quite basic sets of resources from the climate people. And over the years, there's been a sort of a meeting of minds of this. So it's no longer the climate people trying to, I think, push quite sophisticated products at the health people. There's a real conversation going back and forth about what we actually need, working together on problems, ending up with solutions, and then coming back and doing it better next time. It's probably, I think it's unprecedented in science that we have such a strong body of evidence on such an important topic. So I think the evidence has got better. And I think people have just basically, they've taken their time to work this out. There is a tradition, I would say, on the health side of people dealing with individual diseases, trying to find the cure for the individual disease or the intervention for the individual disease. And there's a realization has come that we're living in a more complicated world now. We can't afford even just to deal with all diseases just by treating them. We literally cannot afford that economically. So we're going to have to work on prevention. We're going to have to work on the causes of diseases. And that means dealing with environmental risk factors, from climate change to air pollution to land use change. And over time, people have come to understand that, and I would say a new generation of climate scientists and health scientists is coming through, which understands that and is interested in working it out.